Okay, so I'm going to try this again. I did a whole video a minute ago and it had no sound, so I should have checked the sound before I started because I just updated this UCam. Okay, so about intractable pain and getting it on the map and my journey here. I know I haven't made a video in a while. I've been through quite a bit in the last several months, so here's what I've come up with. I have done some inquiring. I've also been fighting for my own rights, as you probably know. So that's been a difficult task. I've been doing a lot of investigating, and I've actually been in on some webcam webinars with the CDC and learning about the fight on the opioid crisis. I mean, it's becoming nationwide, worldwide, actually. And the problem is that I get the strive. I do to stop the crisis. People are using heroin at a very high rate, and it's awful. People do misuse medication, and that's awful, especially for people like me. But the fact remains that somewhere along the line, people in my condition got lost. I'm a non cancer patient, but I have intractable pain. I was hit by a drunk driver 31 years ago. He tore my body apart. And in the last 9 years, I have gotten really bad. I am now to a point in the last couple of years where I'm really bad. I am bedbound most of the time. I am housebound all the time. I think I might get out of the house 2% of my life. The other 98% is spent sitting on the couch or laying in my bed. I would actually say 95% of it is laying in the bed on my heating pad, and the other 3% might be sitting on the couch. But I am really technically housebound. Now, I've been investigating into all of this, and what I did was I actually started fighting for my rights here in my state, and it opened up a can of worms. So you need to be very careful how you do this and be ready because it's going to be something you have to fight for, and you have to be right on your stuff correctly. I did go to the medical board, and I did go to the head of my uh, medical group, the your doctors with a medical group of some kind usually, and I went straight to the head of that medical group. I've contacted many people. I'm requesting palliative care because palliative care is not restricted as regular chronic pain care is. If you are bedbound, housebound, you're in that much pain and you're as bad as I am, then you should be technically on palliative care. Now, I have a caregiver that comes to my home 3.5 hours or so a day to help me get a few meager things done, help me bathe, things like that, fix me some food. Um, Although I probably could use more help, but I'm independent and I want to be able to do things on my own as much as possible. However, because of the lack of pain care, I'm really stuck here in misery all the time. And what happened in the system is palliative care was excluded in the guidelines along with cancer patients, active cancer patients, and end of life patients. But people have now confused palliative care with hospice. Hospice basically is when you're basically sick in bed dying of a disease, and basically most people with cancer in the end stages or end of life are on hospice. But palliative care is not hospice. There is a difference. A person who has a condition that is for the rest of their life and it makes them house and bed bound and incapacitated and in severe pain should be on palliative care. And that kind of care is strictly for people like me and you if you have this type of pain where you can't get a cure, there's no cure for you, and the medications that they're allowing you to have are not working, they're not strong enough, and the doctors are obviously lowering doses or not increasing them as needed. Palliative care doctors will, their job is to increase your quality of life and make you as comfortable as possible until you die. Even if that's 10, 20 years down the road, that's their job. And that's what palliative care is supposed to be. Now, somewhere along the line, the definition of palliative care has gotten misconstrued and has turned into hospice care, and they're not the same. So we need to teach our leaders and our physicians and our people that palliative care is different and it is for people like us who are bed bound or house bound due to pain and due to a condition that may not be life threatening now, but will be here until we die. And they need to make us as comfortable as possible. Now, if we can get a palliative care doctor that will help us, then we should be able to get enough medication to help our pain enough to where we are not in such agony. Now, aside that, we also need to get intractable pain itself put in the guidelines and recognized and noticed. Intractable pain was somehow sidelined throughout all of the new rules and the changes. We got sidelined. We were kind of thrown in the category with chronic pain, which, yes, it's chronic, meaning it's very chronic, it's all the time. And and then we also have your acute, which is minor pain, or it just kind of goes away. But intractable pain is something that doesn't ever go away. I'm sorry, I'm having a little pain right now, and it's uncomfortable to sit here this long. So I'm going to try to make this fast because I hurt. But for people that are intractable pain, we've got to stand up together, and here's what we need to do. We need to start writing our senators, our governors, our House representatives. Everybody has a representative in their area somewhere. In whatever district you're in, you need to find out who your representative is for your district from your area code or whatever, or your zip code, I mean. And then you need to contact them. You need to contact the head of your medical facilities. Find out if you have palliative care available to you. You need to go to your physicians and do what they say, but let them know every pain you have. Because if we're not telling them everything, if we're just saying we're in pain everywhere, we're not going to get anywhere. We need to detail everything that hurts, everything that triggers the hurt, everything that, every area, every little thing. We want to be tested. We want MRIs, x-rays. We want to get everything on record, everything possible. If there is a treatment that they can give you that is not invasive, that doesn't bother you, you need to try to take it. If you're really in pain, then really getting out of pain is our goal here. However, there are some of us, like myself, that no treatment will help. Now, they did suggest I did have to go see a pain doctor recently, just to keep the medications I'm on now because of the new guidelines and everything. My physician wanted me to go see a pain specialist again, who barely listened to me and didn't even do an MRI or an x-ray or anything. and suggested getting a spinal cord stimulator. It's a surgery. um, I could try it out, which is a minor surgery for first, and then if it worked, I could go in for the major surgery where they basically put the electrode, basically electricity, little string things on your spinal cord, and I can adjust it with a little thing, and it does the tens, if you know what the tens is, the pulses of electromagnetism, basically, electrical shocks. And unfortunately, she didn't do all the research on me, and I did research on the spinal cord stimulator, and I'm not a candidate for it. Actually, it's going to be very dangerous for me to do. I had hope for it, but after looking into it further, because of my scoliosis, because of all the damage in my spine, because of the damage in my pelvis and the crookedness, and because of all of the damage I have, it is very dangerous for me, and it could cause me some serious problems and could even paralyze me. Of course, if they slip up, it could paralyze me anyway, or anyone. So I'm not doing the spinal cord stimulator. It's invasive, and I've been invaded enough. 31 years of invasion is enough. Um, anyway, so we're looking for a palliative care doctor for me now. The um, the pain specialist okayed my medication regimen I'm taking now, so they're not reducing me, thank God, anymore. But they're not getting me to where I need to be either, which is what I was taking before. And the only way I'm going to get there is if I get a palliative care doctor who will come out to my rural area, which they have not found one who will come out here yet. So I'm stuck in misery. I just got a new prosthetic leg, and they ordered a walker for me because my cane, walking with my body weight, I'm crooked, and I've jammed my shoulder out really bad. It cracks and it hurts, and my hands hurt so bad. I wake up screaming at night all the time. It's been just horrible. Even on my good side now, I'm going bad. I have knee problems now on my good side. So my whole left side is all messed up from the wreck, and now my right side is messed up from overuse and damaging it over the years. So now I'm going to be on a walker soon, um, just to get around my house. And that's I don't know how well that's going to work. Tight corners, a small house. I'm not rich. I live in a little, manufactured home. I'm a forgotten one, basically. So we have a call here that we're going to ignore. Ugh, that's not the call I was waiting for. Ugh, sorry, guys. So, anyhow, what we need to do is we need to get a hold of our senators and governors. And if you're watching this now, you have access to internet somehow. So, find out who is our representatives, or who your representatives are, and you need to write them about getting intractable pain recognized and getting it into the guidelines. Explain your situation. I know some of you are pretty bad, and I know that we need to get this out to them. We've got to be the squeaky wheel. The squeaky wheel always gets the grease, they say. Well, we have got to be the squeaky wheel. We're going to hit the dead ends. There's no doubt about that. I've been hitting dead ends left and right, but I've also got some things accomplished. Um, my physician was lowering my dosage starting last year, and now I'm back to where he started from in the beginning, um, because of the pain doctor. So I'm back there, but that is half of the dosage that I was taking when I was working and doing fine. And of course, I'm worse now, so I need double what I'm getting now in order to even function at all and get out of this bed and do anything. I mean, I can't even enjoy going to a movie without being in extreme pain, and so I don't even want to go. I can't go to a birthday party. I can't enjoy anything because everything hurts. I only do what I have to do. Like, for instance, go to the doctor's office, go to the grocery store once a month. When I get my EBT filled, I go to the grocery store once a month. That's it, and then I'm done. I go to the doctor once every 3 months, and pick up my medications once a month because I have to pick them up physically. Those are the only things I ever do. Other than that, I'm home and in bed. And when I go do those things, I'm home in bed in extreme pain, crying, can't do anything for days. 3 days, maybe four sometimes. And it's just horrible. I'm crippled by this pain. So, I know there are a lot of you out there who are the same as me. This is what is intractable pain. This is what I call intractable pain. I'm in a severe state of constant pain that most people would probably shoot themselves over. And sometimes, yeah, I just want it to end. But I'm not going to do that. I'm not going to shoot myself to get out of pain. Although, yeah, that would probably get me out of pain. But no, we need to fight this. We need to get this out there. We need to contact our governors. We need to contact our senators. And most importantly, the Department of Health Services, DHS, and the CDC, because they are the ones, and of course our own medical boards in the state, because they are the ones who are doing the studies and they are getting all this information, but somehow we got sidelined away from them, uh, and they're the ones who are making all the rules. We also need to get an IPD code made, which I'm working on, because there is no IPD code for intractable pain. Now, an IPD code is basically a code that a doctor, a hospital, a pharmacist, whomever puts into the system, and that's the code they use for billing purposes, for writing prescription purposes, and to keep track of diseases and conditions and whatever. So let's say you have a fractured hip. There is an IPD code for that. Uh, Whatever the case may be. Chronic pain, there is an IPD code for that. Intractable pain, there is no IPD code for that. We need to get an IPD code for intractable pain. Start looking that up. We need to work on that. And like I said, contact your officials. We need to write them. We need to get it out there. Get a palliative care doctor if you can. Ask for one, or look on your medical stuff. Call your medical provider. If it's Medicare, Medicaid, you have to be with somebody. Like, for instance, I'm with United Healthcare Centennial Plan here in New Mexico. That is my Medicaid, really, but my Medicare is the primary, and my Medicaid is the secondary. But I go through the United Healthcare for about everything. And what we need to do is find out who takes Medicare, Medicaid, or United Healthcare Centennial Plan, in my case, with Medicare, who takes that insurance that is in palliative care. If you have one close to you, contact them. Have them come visit you. You need to get this done, because if you can get a palliative care doctor to start caring for you, they don't have the restrictions. If they see that you're at the end of your rope, that your pain is so bad, you're going to be this way for the rest of your life, you've done everything else, and they see you're pretty much bedbound and you're miserable, their job is to give you a better quality of life. Their job is to make you comfortable for the rest of your given days, however many days that may be. because when you're in pain like this, your days are numbered. You whether they worry about you overdosing, but at the same time, I know myself. I know how much is too much, and I know how much is not enough, obviously. I would never take too much, and I would never overdose, but that's what they worry about, see? But they don't worry about making sure I get enough. Well, palliative care doctor, that's their job. They will worry about that I'm getting enough to make me comfortable for the rest of my life, because I could die from heart attack or stroke from pain surge. Because the pain is so great, it increases my blood pressure. The increase of my blood pressure on a constant basis is a stress on my heart. It's a stress on my body. Eventually, from pain alone, I will probably have a heart attack, a stroke, or whatever, and die. So, either way, I'm headed to death from pain or whatever. Now, if they got me on palliative care and got me comfortable enough to where the pain isn't bothering me as bad, then I probably could live another 31, 41 years or so. I'm sure of it because I'm a strong person and I've already lived 49 years, 31 of that in this disabled capacity. So I'm pretty sure that I will live quite a long time if my pain is controlled enough. So that's something that they need to consider. We all need to stick together. We need to write these things out. If you need help with it, then let me know. Write me an email or comment on here and we can discuss what you need to write or whatever. I need to know exact conditions though. I need to know what's causing the conditions. I need to know if they will consider it intractable pain or palliative care basis. Because if it's just a chronic condition of something that is not as bad as what I'm going through anyway, then they're not going to consider it. But if they don't have anything to cure it or heal it, and it is that bad, then they need to do something about it. And you should qualify for the palliative care. You should qualify under intractable pain. So we need to get that out there. I'm sorry it's been so long. I'm going through a lot of stuff. Waiting for this walker. I've got a leg that's got blisters all over it. Like I said, I got a new leg and it's bad and I have blisters all over. I can't even get out of bed right now. I'm waiting for a ramp to be built. I'm waiting for this walker. I'm going through so much right now. On top of that, I opened a can of worms because I had the medical board fighting for me. I've got to go. Thank you.